Dominant narratives are explanations or stories that support and reflect the most powerful social group's interests and ideologies. They describe the dominant group's explanation for societal events, guiding perceived reality. At the AMA, we recognize that there are harmful dominant narratives structurally embedded within our healthcare system that perpetuate health inequities and lead to poor and avoidable health outcomes. Advancing health equity requires physicians and all healthcare workers to develop a critical consciousness of root causes and structural drivers of health inequities in their communities, including how these dominant narratives influence patient care, healthcare reform, and our understanding of health equity statistics. Ultimately, noticing, disrupting, and correcting these dominant narratives requires us to critically examine the language we use in our communication. To lead this work, the AMA, in partnership with the Association of American Medical Colleges, AAMC, Center for Health Justice, offers a guide that provides recommendations for centering equity in communication. Designed for physicians and other healthcare professionals, Advancing Health Equity, a guide to language, narrative, and concepts provides actionable guidance and promotes a deeper understanding of equity-focused, person-first language and why it matters. This guide sets out to assist physicians and healthcare workers to recognize the limitations and harmful consequences of some commonly used words and phrases, and offers equity-centered alternatives that encourage patient-first language. For example, we recommend avoiding the use of adjectives such as vulnerable and high risk, which can be stigmatizing, vague, and imply that vulnerability is inherent to the group rather than an external factor. Or avoiding the use of dehumanizing language by using person-first language that describe people as having a condition rather than being a condition. This guide also asks physicians and healthcare professionals to apply a health equity lens, framing questions like, how do we act on root causes of inequality to meet human need? Instead of, how do we treat the consequences of health inequity? Shifting the dominant narrative about health equity may seem like a daunting task, but we can each play a role in challenging and questioning these long-perpetuated dominant narratives. In doing so, we can reveal the sources of inequity and the mechanisms that sustain them. Call for the social responsibility of health systems, corporations, and government agencies, provide solutions that end inequity, and encourage public dialogue on structural racism and all forms of oppression to encourage a broad public response. Our purpose is to make injustices that perpetuate health inequity visible. Our collective success depends on developing narratives that move and motivate both constituents and colleagues to advance health equity. That is why an effective, compelling health equity narrative is essential to transform power, end dominant privilege, and provide meetings that will galvanize possibilities for equitable cultural change. We welcome you to join us as we lead this charge together.